Hello all. Today we'll see a concept of pain-free cancer. What does it mean? It means if somebody is suffering from the cancer, we decreases the pain associated with the cancers. We as a pain specialist are working very hard to work on how to decrease the pain of the patient who is suffering from the cancer. Now we can see a commonest complaint of the patient who is suffering from the cancer is a pain. Pain in the respective area. For example, the one who is suffering from the mouth cancer have pain around the mouth area, pain during eating, swallowing. A patient complaining may have pain in the breast if somebody is suffering from the breast cancer, or pain in the abdomen if there is an abdominal organ cancer. As you can see, the pain is one of the commonest complaint. Almost 70% of the patients suffers from the pain. Apart from other, decreased appetite, constipation, dry mouth, nausea, lack of sleep, vomiting, edema, coughing, these are the another complaints. And we at the pain management or palliative care management center, we try to decrease all these symptoms of the patients. For that, we need to understand why there is a pain. Pain in the cancer patient could be related to the disease. Tumor, a mass causes a pain. A metastasis, that means if the disease is spread to other organs, that can cause a pain. It may be related to comorbidities. Some elderly patients may have an arthritis, age-related changes which causes a pain. Treatment-related pain could be there. For example, if there is surgery post-surgery, this patient can have a pain. Sometimes chemotherapy leads to a pain because chemotherapy, few of the drugs of chemotherapy which affects the nerves, and a debility related pain could be there. Now, if there is a pain, what does it mean to the patient? Okay. To the patient, if there is a pain, it means is it a poor prognosis or is it an impending death? No, dear friends. If there is a pain, it might not be an indication that the prognosis is poor. Sometimes even if the prognosis is good, pain can be there, and that's the reason we need to treat this pain. Pain leads to a decreased autonomy. That means patient cannot work by its own, and this is very agonizing symptoms. It decreases the enjoyment and quality of life. It challenges to the dignity of the patient. That's the reason a control of pain in such patients is of utmost importance. It is threat to increase physical suffering. What is our aim as a pain physician or as a patient? What the patient needs? Aim is to have a socially and economically productive life. Increase compliance to the treatments. Aim for the pain score of less than 4/10. That means patient should be comfortable. No, this agonizing pain is very disturbing to the family as well as the patients. How we treat this patient in cancer pain? Okay, and what are the cancers in which the patients can be treated? All types of cancers, pain can be treated with either few drugs. These are the routinely prescribed drugs. This and paracetamol can get at anywhere. Opioids like buprenorphines, morphines, some patches. These are the commonly prescribed drugs. Okay. Anti-tumor therapies like chemotherapy, radiotherapy, surgery. If the cancer is removed, the pain is less. Now, there are 2-3 things which helps us to tell that the pain is managed by pain physicians. That is neuroaxial analgesia or epidural analgesia, intrathecal neurolysis, or neurolytic blocks like injections at specific nerves leads to the pain, decreasing pain in such patients. What are the commonly performed interventions? Epidural block, epidural injection, and this can be given for the pain any cancer from the neck up to the toes, like cancer lung, cancer breast, lymphedema due to the cancer can be also treated with the T2 sympathectomy. Celiac plexus block helps in usually cancer pancreas, cancer stomach, cancer is small intestine, liver cancer or liver secondaries, abdominal cancer. Stellate ganglion block, we give this injection. These are the very simple injections, and radiofrequency ablation or neurolysis with alcohol is to be done. So injection, a small injection in the neck for those who are suffering from the head neck cancers. Stellate ganglion block works. Trigeminal lumbar sympathetic block for the lower limb pains. CA prostate, ganglion impar and superior hypogastric block helps. Even the CA rectum, rectal cancer, cancer at anal region or rectal region, superior hypogastric block works. Sometimes now we put a continuous epidural or intrathecal catheters, and we have devices, so we put it into the spine and give injection through that. That causes a really a good help to the patients. Let's discuss some patients and few therapies. So she is 49 years female, CA pancreas, cancer pancreas, post chemotherapy surgery. She had, even in spite of her treatment, she had a deep boring pain in epigastrium radiating to back, and it was continuous. Pain was severe, 8/10 is a severe pain, and was not controlled with morphine. So morphine is one of the gold standard drug for the pain during the cancer, and the pain was not controlled with the morphine. What we did is a CT scan guided celiac plexus block was given. There was immediate pain relief. A patient was off morphine, and SOS, a simple medicine ibugesic plus, was given to these patients. So how do we do that? We ask the patient to lie in a prone position in a CT scan suit, and can you see the simple injection? Can you see the needle? So we give the simple injection over here, and drug to be deposited into this area, and the CT scan, use of the CT scan increases the accuracy of this injection of very high accuracy is there. Case number 2, a 65-year male having a cancer of buccal mucosa, and there was a recurrence on another side, post surgery and chemotherapy, radiotherapy. Severe pain in the mouth, and especially it was during the deglutination. The pain score was 8/10, the sleep was disturbed. He was already tried with buprenorphine patches, then morphine, but patient was not compliant with the medicine due to severe side effects. And what we do is a C-arm guided stellate ganglion block was given. So how to do that? We give a small injection. Can you see this needle coming from here? This is a neck, and this is a dye spray. Before an injection, we give some dye to see that a needle has reached a desired place. And this patient has got a very good relief after the stellate ganglion radiofrequency. One more case is 70 years male having a cancer prostate, metastatic orchidectomy was done. Patient was having severe pelvic pain and leg pain because the bone scan suggestive of the pelvic bone femur metastasis, a lot of bones there was, and disease spread. Patient pain was 10/10, unable to sleep. Patient was receiving the morphine, but unfortunately there was no relief, but patient was very much drowsy after the morphine. So we decided to go ahead with the CT guided lumbar sympatholysis. And after sympatholysis, patient had a complete pain relief, almost near complete pain relief, and needed only tramadol SOS during this period. We can see this needle, and under the C-arm guidance, an exact point where we want to give a drug as denoted over here, and this is a dye, so where we can see the drug was given, and then pain was relieved. Another case, a 32 years male, young male, cancer of tongue, severe pain, and it being tongue cancer, pain was difficult, there was swallowing difficulty. Even the liquid or saliva swallowing was difficult for the patients due to the pain. He was on 200 milligrams of morphine daily, there was a partial relief. Patient was also having severe earache and headache. What we do is we just give a glossopharyngeal nerve block, radiofrequency ablation. Patient has 70% of pain relief. So apart from the few blocks, we have intrathecal pumps, we have spinal cord stimulator. These are the advanced modalities to treat a cancer pain, and then we can do that safely. Most of the time it's safe. Now one question is, if the patient is suffering from the cancer, when should the patient come to us? What will be interaction of the drugs or chemotherapy or radiotherapy and whatever we are doing? So when should, let's come to the first answer. When should patient come to us? At the time of diagnosis, if the patient is having pain, if there is a post-surgically pain, if there is a recurrence and there is a pain, if there is a pain due to metastasis, or when patient is receiving palliative chemotherapy, radiotherapy, and even the terminally ill patients. All these patients can come to us and get the pain treated, because getting treatment of pain is one of the most and crucial part in the. Dear friends, we always say the pain is inevitable, but the suffering is optional. Visit us on www.painx.org. We have a second opinion and video consultation available. And for an appointment, you can call us or WhatsApp us.